You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to the program. Joining me now, Dr. Cam Patterson. He is the Chancellor of UAMS. Always good to see you.
Great to be here.
Yes, thank you so much. You have had a big week.
We have had a big week.
Meeting your $30 million goal so that you can now move forward in the next phase of this National Cancer Institute designation. Before we get into that, I want my props for helping you get the ball rolling on this. Your very first tour of the facility with then Governor Asa Hutchinson, and I think I was the only reporter that showed up for it. And I asked him, if you recall, hey, how much money are you gonna commit for this NCI designation? And he tap danced a little, but he came through.
Oh, he totally came through. So, this process began in the 2019 session. And Governor Hutchinson was a big cheerleader, and the first tranche of money was through the medical marijuana tax, and then we subsequently switched that to a $100 million lump sum from the state, and the commitment was always that UAMS was going to be a part of this, that the state was going to be a part of this, and that our donor pool was going to be a part of this. So we committed to raising $30 million in philanthropic support for the Winthrop P. Rockefeller Institute for National Cancer Institute
How hard
designation.
was it to raise $30 million for this?
Not as hard as you think, because it's for such a good cause.
Yeah.
I think people realize that there was a very tangible outcome to this gift, and that tangible outcome is bringing National Cancer Institute designation to the state of Arkansas.
So for people that don't know, I do, because we've reported on it since 2019, as you indicated. What does having National Cancer Institute designation or status, what does that do for UAMS and for the state of Arkansas?
Well, number one, it's prestige. There are only 72 NCI designated cancer centers in the country. So if you can advertise yourself in that way, people understand that means you're the top of the top. So number two is money. It gives us money to do research, cutting edge research. It will add about $72 million a year annually to the state's economy, 1,500 jobs. And third, and most importantly, it brings to Arkansas drugs, experimental therapeutics that are only available at NCI designated cancer centers. So it means if you're a woman, you are in Arkansas, you have an increased risk of breast cancer, you don't have to leave the state to get cutting edge care. If you're a man with colorectal cancer who lives in the Delta, you've got to double the rate of the national incidence of colorectal cancer. You can get therapy that's cutting edge here. You don't have to go to MD Anderson.
There'll be some trials of things going on as well in the course of that. Not that I think there are already at UAMS, but there'll be more of that sort of thing. So when you hear about something that hasn't maybe become widespread or hit the market yet, that will also be something that UAMS will have kind of an inside edge on.
That's correct. And we are dedicated to bringing cutting edge, state of the art care to Arkansas. A great example of that is the Proton Beam Therapy Center, which is a great collaboration between UAMS, Baptist Health, Arkansas Children's, and Proton International. It's the only proton beam therapy center in the state of Arkansas. It allows you to have your cancer treated with the least amount of damage to normal tissues. So treatment modalities like that are what we're all about.
I want to move to some other topics, but just the last one on NCI, what's the next steps now for moving forward on that? And are you planning on another designation of something else, or do you feel like, hey, we're good, let's get this one going first and then we'll move to something else?
Well, when I came here, there were three big things that I felt like we needed to accomplish. We needed during the initial part of my time here. One was getting our Clinical and Translational Sciences Award refunded, and Laura James, the principal investigator, did that. Number two is to get magnet designation for our hospital, and actually this week we submitted our magnet application as well to get nursing magnet status. So number three is NCI designation, and right now our goal is to submit our application in 2025, so that's just right around the corner.
Yeah, what does magnet, what does that do?
So magnet designation is a designation that honors commitment to nursing, nurses' autonomy, giving nurses a voice in the organization. And it's a big deal for two reasons. One is it improves our national rankings. It's a component, for example, of the U.S. News and World Report rankings. But more importantly, hospitals with magnet designation are known to have higher quality and higher safety indices. So it's good for patients.
Great segue into a larger topic. We have nursing shortages, we have healthcare worker shortages, we have physician shortages. Where do you want to start on what's being done with that? Is it an insurmountable problem, I think is my question. We've been talking about for more than 20 years that I've been covering healthcare as business, and it's been a constant. I remember we had a nursing shortage commission at the state of Arkansas. We still have a nursing shortage. What are the solutions for this?
Well, so that's a good question. It's a chronic problem, especially in rural states where it's hard to recruit people in sparsely populated areas. But obviously, COVID-19, lit a fire underneath our workforce challenges, both on the nursing and physician side. I think the solution is not to continue to do what we're doing, which is hand-to-hand combat, where we are fighting with other healthcare systems for a limited resource. I think the solution is, let's figure out how we empower people who are practicing to practice at the top of their license. Let's give more autonomy to providers who can help stretch our physicians and nurses so that they can accomplish more. And let's figure out how we value people better so that they feel that the work that they're doing is meaningful. I think things are getting a little bit better on the nursing side, but conversely, they're getting worse on the obstetrician side.
Yeah.
Southeast Arkansas is now an OB desert. So we do have a lot of work to do, Roby, and it's not going to get fixed overnight.
What are we not talking about on the healthcare front that we're going to be talking about or need to be talking about 6 months, 12 months from now?
Because of the funds that flowed to support healthcare during COVID, a lot of healthcare systems kind of had a little bit of extra cash in the bank. That's gone now. And
why is it gone?
Well,
the money's not there anymore, but
the money's been spent.
You got to adapt expenses differently.
The money's been spent, and in the meantime, we've gone through a phase of wage inflation, inflation in the costs of supplies for hospitals, and reimbursement has just not kept up with that. So what we'll be talking about over the next 6 to 12 months are hospitals that are put up for sale here in Arkansas, potentially hospital closures, certainly closures of services, and we've already started to see that. There are a couple of hospitals that are on the market right now in Arkansas, and if they're not buyers, do they stay open for business?
Yeah.
That's not certain.
Are you seeing a rise in uncompensated care? Some hospitals are as well.
Some hospitals are. We do have more people who've been removed from the Medicaid rolls over the past 12 months. We've not seen a substantial uptick, so that's not what is hitting our bottom line. What's hitting our bottom line is increased costs.
Yeah, so you're talking about the wage inflation,
right.
The supply. Is that coming down? Is that changing? Is it still on the rise?
It tends to be one of those things that only likes to move in one direction.
All right, he's Dr. Cam Patterson. He is the Chancellor of UAMS. Again, congratulations on that National Cancer Institute designation. That is a huge accomplishment. And the fact that you did it in 5 years or less, I'm kind of impressed, to be honest with you.
Well, I told my team we're going to pick another number and start over again.
All right, thank you for being here.
Absolutely,
All right.
Thank you.
All right, we're back with more right after this.